A deadly health scare on the high seas now has local ties. A Virginia passenger is back home after being aboard a cruise ship linked to the deadly Hantavirus outbreak.
Our Jess Arnold is live outside the Fairfax County Health Department with more on how local health officials are responding. Jess, there are still lots of questions this morning about what's going on.
Yeah, that's right. And I do want to start off by being clear that we do not know specifically where in Virginia this individual is located. That information is being withheld for privacy reasons. But we do know that the Virginia Department of Health is monitoring this case. They oversee the spread of diseases across 35 health districts in the Commonwealth. They have 100 offices throughout the state, including the one I'm at now here in Fairfax County. We're also getting to hear directly from the commissioner with the Virginia Department of Health. That's Dr. Cameron Webb. He said that they are in daily communication with the person from that cruise ship, calling, even texting every day as they monitor any symptoms that might emerge. He says the former passenger has been eager to stay in touch and is not currently showing any symptoms. They are one of a handful of Americans who disembarked from the ship soon after the hantavirus outbreak began and after the first of those 3 deaths were reported. Dr. Webb says VDH's current mitigation efforts follow the recommendations from the CDC, meaning the individual is not required to isolate when they do not have symptoms. He said this person is self-reporting daily, including checking their temperature twice a day and going through a checklist of symptoms. If they start to develop any, that's when isolation would be required.
Isolate and actually connecting them with healthcare providers pretty immediately. So we've already set the stage in that region, make sure that the health providers know that they're able to come to a facility that has that higher level of care for some of the worst outcomes we can see from hantavirus.
He said from the information that they've gathered from ship passengers, there are fewer than 5 Virginians still on the ship, so they are putting protocols in place to be ready to receive them when they are able to disembark. Dr. Webb also said they've been working with the CDC, who has in turn been coordinating with the World Health Organization. California, Georgia, and Arizona are also monitoring cases in their states. Now, infectious disease experts have said this is not COVID. This remains at a low risk to the public. Now, when it comes to how hantavirus is spread, that is through contacts with rodents like rats or mice. And some of those symptoms that they look out for are similar to flu, fatigue, muscle aches, that kind of a thing. So they said that it's similar to many other things. So they're trying to be extra careful when it comes to these cases. We'll keep you posted as these officials continue to monitor, because those symptoms can appear within 1 to 8 weeks of contact. Guys.
Right. For the moment, should the public be worried? Not necessarily. We'll keep you guys posted on any updates. Jess Arnold reporting for us this morning. And travel insurance is really helpful if you have any greater concerns about an upcoming trip. We'll see you soon. Thank you.